Leopold's maneuver. It is a systematic external palpation of the maternal uterus to the abdominal wall to determine the following. So, number of fetus, presenting part, fetal lay, fetal attitude, degree of descent of the presenting part into the pelvis, location of the fetus back, and to assess for fetal heart tones. So now we proceed to maneuver. So we have fourth maneuver. So the first maneuver, this maneuver identify the fetal lie, longitudinal or transverse, and presenting part. And then the second maneuver, this maneuver validates the presenting part by locating and palpating the motor contour of the fetal back using the palm of one hand and the irregular small parts of the hands, feet, and elbows using the other hand. And then the third maneuver, this maneuver determines the part that is presenting over the true pelvis inlet by gently grasping the lower segment of the uterus between the thumb and fingers. And then the fourth maneuver, this maneuver determines the fetal descent. So we have the good attitude if brow corresponds to the side that contain these elbows and knees, and then poor attitude if examining fingers will meet an obstruction on the same side as fetal back. And it is also palpates infant antero-posterior position. If brow is very easily palpated, fetus is at posterior position. So equipments needed: stethoscope, fetoscope, and Doppler unit, and of course the tape measure, and then watch in the second hand, and KY jelly, and of course the tissue paper. Knock the door before you enter. Good afternoon, ma'am.
Kumusta pod?
No.
So, ako din si Maria Michelle Linding, ma'am, gikan sa Andres Bonifacio College. Ma'am,
Level
ko
2.
sa imong Leopold's maneuver, ma'am. Okay ba nimo, ma'am?
Oh,
Sa ngalan nato gali, ma'am?
Carlota.
So, Carlota. Then, ma'am, kung sa imong birthday, ma'am?
March 18.
The assessment, assess client's menstrual period. So, ma'am, kung sa last nimo gidugo, ma'am?
October 10.
So, kuan sa imong pagkuan, ma'am, sa deliver sa imong bata, ma'am, kay July 17, ma'am. So for the planning, wash hands thoroughly to prevent cross-contamination, and then explain the procedure to the client. So, and then instruct the client to empty the bladder, and then provide the privacy. Then, atong i-close ang mga curtains, doors, and windows, and then ask the patient to assume dorsal recumbent position with knees bent. So, for the implementation, so drape the patient properly, of course, to prevent undue exposure of the client. So, for the first maneuver, stand at the foot of the client facing her and place both hands flat on her abdomen, and then palpate the superior surface of the fundus and determine the consistency, shape, and mobility. When palpating, a head feels more firm than a breech. A head is round and hard, the breech is less well defined. A head moves independently of the body, the breech moves only in conjunction with the body. So, second maneuver, face the client and place the palms of each hand on either side of the abdomen, and then palpate the sides of the uterus. Hold the left hand stationary on the left side of the uterus, while the right hand palpates the opposite side of the uterus from the top to bottom, and then hold the right and right hand steady and repeat palpation using the left hand on the left side. This method is most successful to determine the direction the fetal back is facing. One hand will feel a smooth, hard, resistant surface, while on the opposite side a number of angular nodulations, so the knees and elbows of the fetus will be felt. Gently grasp the lower portion of the abdomen just above the symphysis pubis between the thumb and index finger, and try to press the thumb and finger together, and then determine any movement and whether the part is firm or soft. If the presenting part moves upward so an examiner's hands can be pressed together, the presenting part is not engaged. If the part is firm, it is the head. If soft, then it is the breech. So for the fourth maneuver, face the feet of the patient and then place fingers on both sides of the uterus approximately 2 inches above the inguinal ligaments. Presenting downward and inward in the direction of the birth canal, allow fingers to be carried downward. A rule of determining the duration of pregnancy by measuring the height of the fundus of the uterus above the symphysis pubis. So, to locate the fetal heart tone depends on fetal position, and it is to assess and listen for normal heart sounds and rhythms. So, the normal fetal heart tone is 120 to 160 beats per minute. Fetal heart rate variability is one of the most reliable indicators of fetal well-being.
Go.
And then position the client in an appropriate position. Distinguish maternal from phonic shuffle, and then record the findings and identify any abnormal findings and record or document it.